Good afternoon. My name is Dr. Wong. I'm the consultant cardiologist. Today, we are honored to invite Dr. Tirunawurakasu. He is the Honorary General Secretary of Malaysian Medical Association and also practicing general practitioner. Dr. Arasu has been in the practice of medicine for the last 14 years. He is known among the fraternity as a practicing general practitioner and founded the Polyclinic Chaya group of clinics. And recently, he also founded the Care Clinics Healthcare Services Sdn Bhd. He has been the voice of general practitioners, and recently he was invited to lead the GP at the town hall meeting with the Honorable Health Minister, Datuk Seri Dr. Zulkifli, on the 11th of June 2019. His group practice operates 25 clinics in the Greater Kuala Lumpur, with all the clinics connected via electronic medical records. Recently, a personal health record was also launched as pilot for 2 of the clinics, whereby patients' health records are pushed to the patient via the app. His group adopts to IR 4.0 and moving towards patient-centered care and value-based healthcare by adopting innovation and technology that benefits the patient. This is exactly what I just talked about. What is IR 4.0? Later you tell us. Dr. Arasu is currently the Honorary General Secretary of the MMA and the largest medical association in Malaysia. He was the chairman of the private practitioner section of the MMA since 2017. He is representing MMA in various national communities. Some of the communities that he is a member are DASA, Ubat National Antimicrobial Resistance Committee, and many, many others. So with that introduction, I invite Dr. Arasu to talk about revitalizing GP primary care for older Malaysians. What can private practitioner do? Thank you, Dr. Arasu.
Yeah, I think I have. Thank you, Dr. Wong, for the very kind introduction. Yeah. Buka mask dulu lah. Otherwise the sound is muffled. Okay, thank you, Dr. Wong, and very good afternoon, everyone. So today the topic I'll be just touching on the role of primary care, the GPs in the country. Okay. I think what is healthy aging, I think you all have heard the last 1 day plus, and we know it's basically about developing and maintaining the functional ability that enables well-being in older age. So basically functional ability, how do we maintain that? Okay, I think the statistics, you all are fully aware about that, that we are moving towards an aging population. Okay, and then this is very important. So what is the role of primary health care? So if you look at here, the GPs, general practitioners known in Malaysia, they are jack of all trade, a master of none. That means we are supposed to know every single thing about GP, about a patient. It's not only about healthcare, you must also understand about the patient's family, about their economic status, about their family issues. So that is the only way that we can, when they come to us, then we can give a holistic solution, not only a medical solution, because medical solution alone is not that easy, can solve a problem. So that's why we see, we are talking about prevention and promotion. If you realize 2 days ago, our health minister has admitted that we have been underfunded for a long time. Right? We do not spend money on, we do not invest money in health promotion and also prevention. Even though the government has some budgets in promotion, but in terms of individual, as a human being, are we spending, are we investing in our own health? And that is lacking. And then of course, as a primary care physicians, we provide treatment, rehabilitation, and also palliative. Okay. So before I go further, what the GPs can do, let me just run through what is the patient demographic and mega trends that's happening around the world, and Malaysia is not left behind. Okay, in Malaysia, at the moment we have 8,340 GP clinics nationwide, and 80% of these clinics are actually at the urban and semi-urban center, which is in tandem with the population of the country. Okay, and who are the patients actually the GPs are seeing? 80% of the patients seen in the GP clinics is from the age group of 19 to 60 years old. Okay, this age group is very, very important for us to understand, because why? I'm very sure all of you would have heard about all these generation, baby boomers, Gen X, Gen Y, Gen Z, and all these generations, right? And we all know that each generation, their expectations are very different. Okay, and these three generations, the three key trends that shapes the generations, that is parenting, how they've been brought up, and then the exposure to technology and also economy. So their expectations when they see a healthcare professional is totally different from someone probably who was born in the 1950s and compared to someone who's born in the 1920s. The expectations are totally different. So when, as a doctor, when we see these patients, we cannot give the same solution. It may be the same solution, but the approach will be different. So we get to be very sensitive about this. And this is very, very important to understand why when someone ages, okay, when we are 70 years old, who's going to take care of us? So now the caregiver or healthcare professional who is providing the care, they are not only taking care of the one particular patient, but they also have to take care of the family's expectations. So it is very important for us to understand if this particular group is born, probably is a Gen Y or Gen Z, what will be their expectations compared to their parents. So that is very, very important. Okay, and then 60% of patients seen in a GP clinic, they are actually female patients. Okay, so that clearly shows that female probably they are more health conscious possibility. Okay, and then they so we see 60% of female patients, and 70% of patients who comes to a clinic, they are actually married. Okay, this is very important. Why? See, number one, we understand that in any household, a female, I'm not gender biased here, a female, they are very influential in decision making process. Okay, and then if you're coming as a family, as a unit, that means it's more powerful. So when they see a GP, so GP is in a very good position actually to empower them so that the decision making process that happens in the house can be done, especially on healthcare. So that is why normally when a family member, if let's say husband and wife, especially the husband, if you diagnose something, we always say you can bring your wife. Because why? Sometimes the care, you also must need support in the house, yeah? Okay. And 85% of patients seen in a GP clinic, they either have a degree, a diploma, or secondary school leaver. Okay. So that shows they have some level of education when they come there. Okay. And we know the broadband subscription in Malaysia 2 years ago is 39.45 million. That is more than 121% of the population. The population only 31 million, but we have subscribed 39.45 million. So this shows that the internet penetration, that means the mobile phone usage or probably social media and other apps, that means the usage is very high in Malaysia. Okay, and then if you look at patients, okay, many years ago it was very doctor centric. You come and see a doctor, I tell you listen, right? It's a one-way communication, and the fear was there whenever they see a doctor, right? Because why? Those patients who come to see a doctor at that time was baby boomers. Those who were born in the 1950s, before them the post-war. So their attitude towards people are different because they went through hardship. So for them, everything they appreciate. Oh, see a doctor, appreciate. But now you're seeing a totally different generation of people. So we have moved from doctor-centric to patient-centric. It is no more like what I said, I say, you do. It is about shared decision making. That means we share the information with you. You probably would have Googled in the house about the illness. They come, they share, and then we discuss and we give treatment options. But ultimately, the decision is to the patient decide. Okay, we just guide them. And then we have to move towards value-based care. So last time is more to fee for services. Now, for every single cent in the private sector when they spend, they are expecting what value do they get from that. So what value can we give? So this is also very important. And then we are moving towards population health. Today during the pandemic we have seen, right, how they say identify as clusters. So that area, the whole area. So similarly, we are moving towards population health. Probably in for example, in a company, we know what is the population health in that place. Whether how many of them are obese, how many of them are having diabetic. So probably based on this, the office can also come out with some kind of a plans, motivation, how to empower their employees and also so that they can take care of their health better, and that improves productivity via efficiency. Okay. And digital health, like what Dr. Wong mentioned earlier, digital health and digital therapeutics is inevitable. Okay, this is something that very important for us to embrace because this actually can change our health-seeking behavior, our decision-making process, because When we tell you, oh, diabetic like this, you will never listen. But when you see the numbers of your BP, you are seeing with your own eyes, then the decision-making process is much better. And today, we are talking about integrated health network. There's no more working in silo, even though we are still in silo, but the government and the private sector is already moving towards how can we work together, sharing of information, sharing of data. Okay. The other thing we must understand, what are the most important healthcare factors influencing decision making? Okay. As a patient, what is the number one? This study was done by the PricewaterhouseCoopers in US, and I strongly believe that we are not very far from US as well. So the number one is that when they seek for help, is all about convenient and easy access. Today, they want to go to a clinic, they want to make sure they can park the car there, they go and see a doctor, they can do a sundry, they can do a banking, everything. So they're looking for convenient. And they want an easy accessibility to the clinics as well. And then they're thinking whether the clinics, can I use a card? So who's paying for them? So only number three, they are more concerned about the doctor and also the nurses in the clinic. So this is how the mindset now. So I'm not sure in 5 years' time. Okay, this is the current trending that's taking place here. And then they look at the brand reputation. That particular brand, is a good brand to go in terms of quality? Yeah? So only number 5 is quality of care. So that is how it is at the moment. Yeah. Okay. So now what can private practitioners do? What they can do? So as I told earlier, there are 8,350 GP clinics in the country. Okay. And these clinics are all situated at urban and semi-urban area. So today we see the population is also over there. And then we also notice that those who are aging in the rural area and the urban area are also different. The environment is different, probably the stress level is different, the family support are different. So as a GP, what can we do? As I told earlier, prevention and promotion. So we can play a very good role. That means we advocate good health across a patient's lifespan. So sometimes in a GP clinic, we see a few generations. Okay, we could see sometimes 3 generations. If you're practicing for 30 to 40 years, you might even see 3, 4 generations. That means the whole family tree you can see. So it is very important that we continue to educate them the importance of health screening. Why is it so important that you take care of your health so that you do not fall sick? Because when we fall sick, it is very expensive. Okay, prevention is always better than cure, and prevention is definitely a good investment and cheaper than getting sick. So when a person gets sick, it's not only expensive, they also become burden to the family members, to the country, to themselves. Okay, and today the government actually has programs like, for example, PECA B40 for the B40 group for screening, which is free, but the uptake is very poor. So uptake is very poor. And then the Perkeso also used to have a health screening, a basic screening. Again, the uptake is very poor. So everyone is puzzled. Why? Even given free also, there's no uptake. Why? So that clearly shows that probably the awareness, the public generally do not see the importance of doing all these things, even though giving free. So that is very important that we have to keep reminding everyone that it's important. Please do a health checkup. So this is where the primary care doctors, most of the time when you go and see a doctor in a GP clinic because you're sick. So it is also important to go and see them when you're well so that you prevent yourself from falling sick. Okay, so that is very, very important. That means we prioritize patient education. This is something that we have to keep reminding people. Because why? When you see a GP in the clinic, you spend 5, 10 minutes or 15 minutes, so you get motivated, oh, I must do this, I must do that, right? But the moment you walk out from the clinic, you're still motivated. Probably after 3 hours, 4 hours, you go back to your routine, you forget about everything. Because that is the reality of life. Okay, because why? When we do not see something, we say, okay lah, we can wait. Right. So the GP can be a very, very important person for you. You choose somebody, someone that you can go and see and visit. And today, in Malaysia, I would say one individual, especially in urban area, they'll have at least 5 doctors. One is the place where they stay, one is the place where they work, a friend who is a doctor, and then you have a Google, okay, 4. So they have access to a lot of people, and also online nowadays. You can do even online, okay, so 5. Accessibility is there. It's good that you have more access, you can always counter-check of information. It's very, very important. But having said that, it is advisable that you have 1 or 2 GPs, that you have your records regularly on there, Okay, apart from that, you can check with the other GPs as well. That is very, very important. Okay, okay. So what we can do is that we are also looking at the patient demographic. At the moment, as I mentioned earlier, the age group is 19 to 60 years old in the private sector, most of them. Those above 60 is lesser. The reason being, after 60 years old, they retire, right? And even the private sector mostly are retiring after 60 years old. So when they retire, of course, money is an issue. So they would prefer to opt for public hospitals when they have a problem. Okay, but it's also advisable for them at least can see a GP once a year. If they are well, no illness, at least they spend a bit of money doing a simple screening for them, very, very important. So the GPs also, nowadays, many of them are also going into special interest, whereby they can also provide packages for them. Like probably those who are sick, they can provide house calls, okay, or remote monitoring, which I'll be touching later. Okay, clinics are also looking into implement age-friendly services at clinics. As we know that in most clinics in the country, you must have the ramp, it must be a wheelchair-friendly, even the toilets. So all these things are already regulated by law from 2006. So already for the last 16 years, these have already been regulated. Okay, so more and more GPs are coming out. So there will definitely be niche areas where some GPs will opt to go for this kind of more specialized cares for elderly and also aging. Okay, so basically, and also encourage patient and carer involvement. Okay, it is very important, especially when they have aged. Okay, and then if they need a carer or someone taking care of them, it is always important when a care plan is decided or management is decided. It is important to involve both parties, because the carer must understand. The carer must actually understand what actually is needed. What are they supposed to do to achieve certain things? So it's not only the patient, it's also the person who's caring for the patient. And whatever the care plan we devise, it must also be practical. We cannot be theoretical or based on textbook, you do this, it's not going to work. Okay, so we have to put ourselves in the situation of the patient and also the carer, the environment of the house and everything, then we decide so that it become an effective management. So it's also important that apart from listening, but we also have to plan out simple, practical management for them. And apart from that, we must also give basic objectives, simple objectives they're supposed to achieve. For example, if they're coming for wound dressing, what are the level they can achieve? And nowadays with technology, you can take a picture and send to the doctor, you can do so many things. If it's a BP, what are the things you can do in the house to monitor if you're diabetic? So all these things can be taught to them. So self-care, we empower them. So there are certain things, not necessarily you must see doctor every day or every month. Certain things you can do on your own. It's a very basic things like diabetic, hypertension. All these things can be actually monitored on your own. And then you can just see a doctor probably very stable, 3 months, 6 months is okay. Okay, and as we know that mental health conversation is also very important. Mental health is a major issue nowadays, right? With the urbanization, economic stress. I think the last 2.5 years with the COVID-19, direct impact to the healthcare system, to the healthcare of an individual, and also economy of the country and the household has also given a very, very huge mental impact. And more so during the lockdown, you're not allowed to go outside. And if you're staying in a smaller house, like the PPR flats, okay, so the stress level will be even higher. So imagine somebody who's 70 years old or 80 years old or above 60 years old under such an environment. So it is also very important, and more GPs are actually going into this area as well, to give a basic counseling, to pick up early signs of mental illness. What is important for us is that picking up things early. Most of the time, we pick up things late. Okay, like for example, I give a classic example. If a person is having hypertension and diabetes, right? They say, "Doctor, I'm okay, I'm fine. I don't see anything." Because why? What is happening inside, they're not able to see outside. By the time they go and see a doctor, both legs swelling, it's already too late already. Your kidney is gone, right? Some damages are reversible, some damages are irreversible. So we do not want to pick up something when it's irreversible. So similar to mental illness, so that we can pick up things very fast. So when mentally, when we are affected, it's going to affect our physical well-being as well. So it's also important, as I told earlier, more GPs are actually equipping themselves with more latest updates on mental illness and how do we help our patients on that part. Okay, this is something I think Dr. Wong spoke earlier. This is also a topic of my passion as well. Okay, that means utilize the digitalization of healthcare. Okay, how actually this will change and how actually we can embrace. I think in the last 2.5 years during the COVID pandemic, it actually has given us an opportunity also, the importance of digital care. How can we embrace and utilize this digitalization process in our daily monitoring of our own health? Okay, so there are already many user-friendly online platform. Okay, for example, appointment basis. Today even clinic kesihatan, people are slowly getting used to the appointment basis. Okay, they start understanding. Those days they just want to go and get things done immediately, right? So we can see there is a trend shift towards appointment basis. Okay, so these things will take place gradually, slowly will move on. Okay, and then information sharing. Okay, there are many websites that has lots of wealth of information. So similarly, there are also lots of websites with disinformation. We can see during this time, vaccination process, so many things, right? There are so many WhatsApp group, Facebook, that people are more interested to listen to them than the healthcare professionals because they believe in conspiracy theories and so much of theories, right? So it is also important, while there are so much of access to information, we must also ensure that the information we are getting also correct. The source of information should also always be verified. That is very, very important. Okay. What are the benefits of digitalization in healthcare and also especially in the aging process and also elderly care? Okay, number one is responsive and sustainable healthcare. If you have everything, if you have your personal health record, see at this point of time, what you do? You go to a clinic, you see a doctor, you think your healthcare is the responsible person is the doctor. Actually, it's not. We are responsible for our own health. So all our records are there, right? So how important it is, or how nice it is that you have the records with you. So in my personal experience with my patients, what I've seen is that, especially on hypertension patients. So when I set up my practice in 2009, so from the day one, all our clinics were fully digitalized. So we use electronic medical records. So we start capturing BP for all these patients. So we check their BP. So every time they come to the clinic, we check their BP. So we have a machine, the hospital grade 1, and then all our nurses will check their BP. So 1 year, 2 years, okay. Because based on the studies, it shows that a patient will go to a clinic, government or private clinics at least 4 times in a year. That's an average based on studies done in Malaysia. So after 2-3 years, then we start seeing the trending. So these patients, so then I realized after 3-4 years, the trending, some of them even after 5 years, they can see the BP trending from the time I've seen them earlier 5 years ago. The trendings are very, very, they get amazed to look at the trending and they can relate. Doctor, this time I was having a problem with my wife, or this time I lost my job. This happened like 3-4 years ago. They can relate, no, the pressure is going up there. So then what I realized, previously to put them on medication is so difficult. Doctor, I wait first, let me try this, let me try that, I'll come back to you. BP also won't come down, they also won't try anything. But now with the records, when we show them directly with the screen, I said, your BP is like this. Now it's already from Gunung Tahan to Gunung Kinabalu. Next may go to Gunung Himalaya. I said, after that we do not know where it's going. You decide. So we just tell them, based on this data, if it goes like this, these are the complications you will get. Oh, you may lose your eyesight, your kidney might just go off, you may have a heart attack. So only that. So the moment they see this data, they suddenly realize, wow, it is important for them to make their decision. So I personally realized that then the decision making become much easier. So I don't have to make decisions for them anymore. So you decide. You just give them the options. So that is when, after that, I realized, okay, if we can give them the record back home, that's why we came on personal health record. That means we give back all your records back home, so that when you go back, you also can see your record. So you'll be more empowered. You'll be more empowered. So this will also help into prevention. If a person is having diabetics, how can we help and assist them from preventing complications? So this data will be very helpful. And today all these things are very cheap, especially all the gadgets that you can get in the, that you can do it at home is all very cheap. You see, even BP nowadays, we do not tell the patient, oh, now your BP is very high, we're going to start your medication. No more. You see, you got a machine, you monitor at home, you write down, you come and show it to us. Okay, if your record shows good, we calibrate all okay, we will follow your BP in the house. No more in the clinic anymore, because we know they're stressful. Even I myself, when I check my BP, the first time it will usually go up. When the cuff inflates, your heartbeat goes up. So must do 3 times, 4 times, 5 times, then you see come to normal. So it happens to most of us. So it's good that we all monitor at home. This nowadays is all very cheap. All these devices are very cheap. You can take to your phone. There are apps to monitor all these things. So these are very, very important. So this will also remodel the patient-doctor relationship. It's no more the conventional, you must come and see us physically. See, patients are already calling us for simple thing. Our regular patient, they'll call us, hey, doctor, what to do this and that. Okay, informal consultation has been taking place for ages, and we have been giving it for free anyway. Okay, but how can we formalize these conversations, this relationship? See, no matter how high tech we are, you still need the high touch. You see, you still need the high touch to do a lot of things as well. So we can use technology. Okay, we can go and see a doctor one time. Okay, for chronic illness, yeah. Doctor one time, the subsequent one you just monitor remotely, and probably after 6 months you just go and see them if it's very stable. So we empower the patients. Okay, and this also gives you the technology also gives you an advantage whereby now you have access. We can also bring secondary and tertiary secondary care to the clinic, to the primary care. So it will be more cost effective. Let's say, for example, today you are having this, okay, and then I feel, okay, you are a patient with let's say hypertension patient, I'm worried, so we can always do a teleconsulting with Dr. Wong. We can schedule his time and we can do a teleconsulting with your doctor here. So all these things can be done. The technology is already available. This is how we move forward because it saves time. And sometimes you have an elderly person at home, it can also be done remotely. It also can be done remotely. And also, it is also leveling the platform. That means it gives equal advantage to everyone as long as we embrace to the technology. So the technology is already there. What is the challenge is the change management. Whether we want to embrace or not. Not only to the patient, it's also the doctors. Doctors also finding hard to embrace this. My simple philosophy is very simple. We learn, then we unlearn, then we relearn again. That's all. Because that is how dynamic the situation is in the country. I mean, in the world. We can see during the pandemic how things, the SOPs were changing. It's not to say they do not know what they're doing, because that is how the dynamic the disease was. So similarly, things also can be very dynamic in other health-related issues as well. Okay, this is something that I'm doing, and also trying to promote that everybody should be doing. That is how do we do patient monitoring. I think Dr. Wong has already touched that earlier, remote monitoring. Okay, so we can do that for, see, all these things, why is very important, this actually will help you, it's a data-driven decision making. That means you make a decision based on the data that's available. That's number one. Now you can have this data not only to one doctor, you can also check this data with few other doctors as well. So you have access to the information. And more importantly, you are actually empowering yourself. So we are empowering the patient, is more towards patient-centered approach. Okay? And then we can also do teleconsulting if it's necessary. So this also helps in the drug adherence, monitoring, and also compliance. So that whether we know, you can check and see if you're taking this medication, okay, is this medication working or not? So how do we know whether a particular medication is working? Based on the reading. So based on the data that you're getting. So only when you monitor, then you can make your decision objectively as well. Okay? So this can also help on prevention and early detection. It's also helpful for dengue patients. Like today, for COVID-19, the government has done virtual COVID assessment centers. Okay, they even monitor a person on their SpO2 oxygen saturation. And the moment you know that when the oxygen saturation drops below 95% or 94, 93%, they know there's something that needs to be monitored. You need to go to a CAC, a COVID assessment center to be done. So government is already doing that. Okay, I think during the pandemic, the end of last year, probably they were monitoring more than 30,000 or 100,000 people. Big numbers of people virtually they're doing that. And it was very helpful, and it really saved, unlike in the month of May, June, July, whereby there's lots of brought-in death, okay, because of this home monitoring actually helped. So now we are moving towards endemicity. Of course, this trend will continue to take place. So the basic thing, like for example, weight, BP, sugar, these are simple things that you can do at home and then you can monitor. Ultimately, as I told earlier, it's all about prevention, it's all about early detection and promotion and advocacy. So this is what is very important when we embrace technology. Okay, I think this is my last slide. Okay, they can also provide avenues for regular and effective training and education opportunities for healthcare staff at clinics as well. So basically, the GPs are also, I think during the recent programs, I think government on the HRDF program, they're also sending their nurses, their clinical assistants for further trainings. Okay, in the past we have lots those who are SPM leavers, but slowly we can also see the trends are changing. Those who are joining with degree, those who are joining with diploma, this trend is happening. So definitely the quality of service also will also improve. So when the quality of services improve, this also will give support to the aging population as well. In countries like Japan, the primary care doctors play an important role in managing the aging population. Like in Taiwan, they all are very well advanced in terms of managing the aging population. So we can also introduce training programs for healthcare personnel. Okay, so we can tailor-make to the population, because GP practice is very community-centric. Based on the studies that we have done in our group of clinics, based on the 25 clinics that we have, now 30 clinics we have, and since we capture lots of data, so we have realized that 80% of patients staying in the vicinity of 2 kilometers. So we also got a shock. So basically that means they want the closest. So that is how the pattern. So when we look at all the 25 clinics, it's the same trend. It's the same trending. That means GP is very community based. So I would say that GP practice is still very underutilized, because the mindset is always about cough, flu and fever, but actually many of us are actually giving lots of other services, like for example home monitoring. They monitor patients from the home. It's already taking place. May not be in a bigger scale, but sporadically it is happening because some GPs have the interest. But slowly we believe more and more will start doing this kind of approach. Okay, with that, thank you very much, and I hope that I've just given you a summary of what the GPs in Malaysia can do, and we have 8,350 GPs clinics in the country today, and we believe the numbers will grow with the production of doctors that's taking place in the country as well. Thank you very much.
Thank you, Dr. Arasu. I think what you just said, it corresponds with Dr. Raymond spoke about in the session this morning. He said that the healthcare, and especially patients, they look for convenience. So your data about 2 kilometers away from your clinic is consistent with what he said. And I always have the opinion that the GP practice is a sunset thing. But I think you show that with technology, you can actually transform it and make it better. Any questions from the floor for Dr. Arasu? Oh, everybody very shy, huh? So I want to ask you, if there's a single solo GP, they want to have the same system like what you have, medical records and patient access to their data, what is the cost they are looking at?
Okay, the good part is that I would say 80% of the GPs in the country, they have some form of electronic medical record system. That means that investment is already done. So now the next step is that how can they access to systems like this? So what I would tell them at this point of time to advise them is that this system, maybe because of my practice, we can afford it. But having said that, they can see today the phones, they have many apps in the market, right? It's for free. So they can also advise the patient to download these kind of apps so that they can also communicate with their doctors for a very cost-effective way of doing that while waiting for the system to be in place. Because I think the government is also looking into, I was in a meeting a few days ago with the minister, they're looking into the national health screening. They're looking into National Health Screening Month They realized that most of the patients who got into complication category 3, 4, 5 ICU and that cases, majority of them are because of obesity, diabetic hypertension. That means the awareness is not there. So the government is looking into that. So they're also looking into how they can give all these records in the MICE Jatra. So it's going to become very cheap and accessible for everybody. So the important thing for them, the GP, is that use the current EMRs. What is lacking, they're not using it.
Yep. I think this technology allow you to be connected to your patient. You can send them reminders,
Yes.
and also some tips. So when there's a lot of connection, I think they are more willing to come back and see you. So I think that's a way to transform GP practice.
Yes.
Otherwise, it's very competitive.
Yes.
You kill each other.
Yes. Very true.
Yeah. Yes, doctor.
I'm Dr. Ismail. Regularly, some patients come to us requesting some advice regarding the treatment. They usually go to the clinic kesihatan, follow up to take the medication, and also do some lab test investigation. But the trend the behavior of the doctor in the clinic kesihatan is still the same 20 years ago. No? They don't allow patient to bring back the lab result. So that's we face the difficulty to advise the patient according to what the results being done a few months ago, a few earlier. So that's what we always face. So can that thing being changed now? So that the patient is allowed to bring back the result and discuss to other doctors what can be done for them.
That's a very good question, doctor. Actually, we did highlight this to as the MMA. We have highlighted this issue to the government many times in various forums. But actually, many clinic kesihatan, even the hospitals, they do give back, for example, discharge summary, and nowadays they also give back the blood reports. Like for example, clinic kesihatan. I know that in Klang area, in the KL area, in Putrajaya, they give back all the records back to them, especially all the cholesterol tests, everything they give back to them. Even the hospital, the only thing I do not see them giving back, of course, the film is expensive, but they do give back all the reports. Probably it's not happening everywhere, but I think in some major cities, towns, it's already happening. So I think it's a positive trend that I think eventually that everybody will start giving back and then sharing the data.
Dr. Arasu, I think what he's trying to say is that make it compulsory, So you're not KKM, but you are our link to KKM.
Yes, definitely.
So you must do it. You have to tell them.
Yes.
Don't
worry.
Say compulsory. Don't give it to the patient.
Yes. So I think they're on the right trajectory. Probably it's taking a long time, but this is something that we have highlighted because why? We cannot work in silo, and they cannot treat the private sector as their adversary. We all are from the same system. So this MMA has been keep reminding the government. We can see the shift. How they are more proactive and they are accepting this idea, and they've accepted actually a few years ago, I think in 2015, not mistaken, or 16, they actually launched the My Health Data Warehouse, whereby all the data supposed to go there and then access the data to the doctors and also to the patients. So it was there. That means the idea is there, the system is there, but because of various reasons, it has not really taken up.
Okay, any more questions? Dr. Bhaskaran? No. Okay. Okay.
That is all our patients from government polyclinic have their own folder with them.
Yeah.
So they bring to us every time, so we have their complete records. In Sarawak, we have been doing it for many, many years.
Yeah, it's good. Yeah. So like it's happening, but probably in some places that's not happening. Probably it's again that person in charge or the medical officer or senior person who's in charge in that area. But I would say that most major cities, major towns, they're already giving back. Just like the ANC book, the pink book. Patients actually carry with them immunization, so all is being done.
Any more questions? I think MMA play a very important role. We must support MMA because otherwise there's no one for us to connect with the government. And maybe you can elaborate on the MMA role
Okay.
and what you are doing.
Okay, basically, Malaysian Medical Association, we have a strong membership of 14,000 doctors, public and also the private sector. And then we stand for couple of issues. For the profession, we fight for the issues of policy issues, regulatory and also trade issues. For the patient advocacy, patient rights, we also do that. So we sit in various national committees with the Ministry of Health, especially on Dasar Ubat and then Poison Board. So like that we got many access to the Ministry of Health. So we are one of the important stakeholders on various issues. Like for example, recently when Act 342 was announced, we made a lot of noise and the bill has to be pulled back from the parliament, and then they have to discuss with us again, with other stakeholders as well. So we are the voice of the public and also the profession. Things we feel is not right, that doesn't favor the public or the doctors, so we always voice out. So any issues you all have, you can always write to MMA. You can write to secretary@mma.org.my. Whether you're a member, not member, we do not see, because as a National Medical Association, we take care of everyone, all doctors, because when we go negotiate on the negotiation table, we don't negotiate for members, we negotiate for the profession. So we need your support as well. When the number goes up, our voice is stronger, because the government only look at the numbers, because for them is, oh, you got 14,000, you got 14,000 voters. So imagine you've got 60,000 doctors, if 50,000 is members of Malaysian Medical Association, our voice will be extremely powerful. Why we are very powerful? We are also close to the patients.
Yeah, Darren?
MMA has been asking for primary care to be enhanced, and every time when year in and year out when the budget is being tabled, how do you think that primary care can be enhanced in relation to care for the elderly, the older persons?
Okay, primary care to be enhanced, it came out after the Harvard study the government engaged in 2015. So it has clearly mentioned the importance to enhance the primary care. But again, when it comes to budget, the government doesn't allocate any specific budget for the private sector. So most of the initiatives taken in the private sector is own funding. So that is why if somebody wants to go for anti-aging or healthy aging, so it is their own initiative to invest in them. They're investing. So these are the things that is not correct at this point of time. So this is not correct at this point of time. So we are telling the government, because why? On one side, their workload has increased. On the other side, you have the facility, you have the workforce. So it's time that they spend money to get GPs who are interested to provide such services, and then give them the training. So this will also enhance the primary care. So you can find niche areas, like for example, if this particular group of doctors want to do this, they can do that. It's already being done in other countries as well.
Okay, thank you, Dr. Arasu. I think we are just on time.
Yes.
It's good time management. And maybe I finish off with the last comment from myself. I was told from the insider story that the MA has a lot of money. So why don't you use the money to enhance the GP by providing a system for your members? So the system is what you have just done, the medical records and app for the patient to have. And these are only for your MMA life member.
Yeah.
At least you can collect some money, and at the same time you can help them.
Yes.
So suggestion for you.
Actually, we are doing that. We are doing that via Koperasi MMA, via Coop MMA. We have MCHA digital platform. The platform was to digitalize the private sector. So we are doing that today. We have 2,350 GPs there, and it's free for them. So we want to create avenue for business for them at the same time to support. So it's all in work in progress. It's taking place. We will enhance it, Dr. Wong. We'll enhance it, make it better.
Okay, thank you.
Yeah, thank you very much.
Yeah, thank you.